Hi, everyone. Thank you so much for your patience. We ran a little bit over there for a few minutes, but we're glad you're with us here for this March 3rd briefing. And I think as many of you recognize or know, yesterday marked 1 year since the date that we had our first case of COVID-19 in this county. And it was the date that we first opened the EOC. We've been at it for a year now. And certainly what a year it has been, with many ups and downs, much progress, much hard work by many people. So I can tell you that I'm just so proud of our employees here in the county, all that they have done, all the members of the EOC, the staff here in the county manager's office, certainly health, our elected officials, our nonprofits, our for-profits, who have all come together. And that's what we do best in San Mateo County. We collaborate. And it started long before the pandemic, but it has really paid off during this pandemic. And I'm just so appreciative of everyone and for all that they have done. As we go through the numbers here, we see almost 160,000 individual vaccinations that have taken place in this county, with over 63,500 who have received not only their first dose, but their second dose. That's a total of over 222,000 shots in the arms. And a lot of that has been done in a massive way through mass vaccinations, which has taken a tremendous amount of coordination. And a shout out to Ileana Rodriguez, Deputy County Manager, for all the work that she has done there. As we come to you today, we're at 38,000, over 38,800 cases of COVID-19, unimaginable a year ago, but more tragically and more unimaginable a year ago is the 521 COVID-related deaths that we've experienced in this county. The good news is that we are seeing a turn for the better here, with only 39 people that are hospitalized with COVID. It is freeing up our ICU beds and acute care beds. And we hope and pray that this trend continues as we see more vaccination rollout in this county. But we must also stay vigilant, because we know that we are not there yet, and it would be the wrong time to let our guard down and for anyone to think that we are out of this yet. The light is certainly at the end of the tunnel. A year ago when this started, we couldn't have imagined the magnitude, and we couldn't have imagined that we would be doing mass vaccinations this soon in this county. So we're grateful for that altogether. In regard to our mobile testing, we did 5,800 total tests last week, and that remains one of the pillars of moving out of the tiered system. So we'll continue to do that, and thank you to Caroline Blady for all her work as the new czar of testing, and really making sure that really reaches every corner of this county, and everyone has the opportunity to get tested as they see fit and on demand. We continue to be one of the highest in the state in regard to testing, which of course helps with our adjusted case rate. We are number 2 next to Yolo County. We've been alternating between 1 and 2 for several months now. And we're very proud of that effort and all the effort that's taken to make sure that we have testing throughout the county. In regard to the blueprint for a safer economy, the county metrics, as we look at our adjusted case rate on a 7-day average per 100K, we're at 4.0 as of yesterday, just on the cusp of course, orange, where we need to get to 3.9. We know that we've completed our first week in red, and we need to be here for 3 weeks before we can move to orange. The unadjusted case rate, and the 4.0 is the adjusted case rate. The unadjusted case rate is 8.1, and just a few short months ago was obviously dramatically higher. The positivity rate is down to 1.7, which puts us in the orange tier, and the health equity metric is at 3.2, which also puts us in the orange tier. The tier movement, as we talked about, we hope to, in the upcoming weeks, better understand what, if there is a change in the metric, but if not, we'll have to stay here for a couple more weeks to move out of the orange. But there is some type of movement afoot in the state, which we don't know, and we'll hope to learn more about in regard to some announcement later in this week. And whether that has to do with vaccinations or the tier system, we do not know. They could be both in regard to vaccinations and different tier system tied together. So we look forward to understanding more of what direction the state will move in and how that will impact us as a county in our effort to open. Sarija, would you like to go through the vaccination update?
Sure, thanks, Mike, and hi, everybody. So hopefully you've had a chance to look at our dashboards that track our progress on the vaccination rollout for San Mateo County's residents. And if you saw the data that was posted through March 2nd, as Mike referenced, we have had 159,357 individuals who are San Mateo County residents vaccinated. This is just about 1 in 4 of residents age 16 or older, almost a quarter, 24.5%. And if we look at our older adult population who had been our focus, we have reached 66% of those age 65 plus and 72% of those age 75 plus. We know that the older adults we haven't reached are residents who may have additional barriers for whom either the mass vaccination sites or the pathway through their major healthcare provider or even a locally accessible clinic that might require some transportation or support to walk up hasn't been as accessible as necessary. So there's a team working on additional pathways to assist those that have the greatest barriers to getting that first dose vaccine and building confidence in the safety and efficacy of the great vaccines that we have available for our residents. And as I think most of you know, for San Mateo County, last week, February 22nd, we and other vaccinating entities began vaccinating individuals in the 4 essential worker categories that the state added to eligibility. And that includes workers in education, childcare, emergency services, and food and agriculture. And it was really heartening to be able to work with leaders in each of those sectors to reach folks with an initial group through events at our San Mateo County Event Center, as well as other pathways that are available in San Mateo County. And each of those sector leaders had a real equity orientation to who are those workers who have been most exposed, who are those workers that we need to make sure have an opportunity to get vaccinated. We know this will take a few weeks to get to the entirety of this sector and protect all of those individuals who've been protecting all of us. Also last week, we had a few different pilots of locally targeted vaccination efforts in Daly City, in the Half Moon Bay area, and in the South Coast. And that accompanies weekly vaccination pathways in East Palo Alto and Redwood City that have been available and remain available. We were able to work with 2 separate teams that went directly to farms on the coast side to make vaccination more accessible for those workers with the support of their employers, and learned a lot from that effort as well. And we'll be doing more of that in the next week. I think you all know that Monday was the first day of the Blue Shield implementation for the state of California, with the design of improving the speed and scale and equity of the rollout across the state. We're continuing to learn more about what that means for our role. In San Mateo County, the top 3 vaccinating entities remain San Mateo County Health, Kaiser, and Sutter. We also have been pleased to see more vaccine available to local pharmacies through the federal partnership. There are 7 Rite Aid and CVS stores that are part of that partnership. And we also see more local pharmacies being accessible options for many of our residents. We did learn last night about the challenges that Sutter was experiencing with vaccine supply from the state, necessitating Sutter to cancel second dose appointments for many residents, including residents who likely expected to get those second doses at the San Mateo County Event Center. We did reach out to Sutter leaders to ask if we could understand more about the number affected in San Mateo County and any problem solving that could be done to mitigate the impact of that unfortunate set of cancellations. There is a longer period in which that second dose can still be effective, ideally between in that window of, is it 3 weeks or 4 weeks? I'm getting stuck on the Moderna versus Pfizer. I think it's the 3 week.
4 weeks for Moderna, 3 weeks for Pfizer.
Yeah, 3 weeks for Pfizer. But there's a couple weeks, on the other end of that it's still effective, as you would see on the CDC guidance. The next eligible group that the state has identified are adults with underlying medical conditions, and the date that the state has set, and we'll learn more from Blue Shield and the state, is March 15th. That is dependent on sufficient vaccine supply, and we're continuing to be hopeful about what the federal government is relaying about increased supply becoming available even earlier than had been expected due to the work of the Biden administration.
Great, thanks, Sarita. And just to update everyone on upcoming mass vaccination events, we're running second dose clinics today at the event center and tomorrow, where we hope to vaccinate 3,200 people a day. And then we'll be doing on Friday first dose vaccine clinics for this Friday and Saturday at the event center for phase 1A healthcare workers and phase 1B 65 plus and essential workers. And Sarita touched on, we hope that the vaccine supply will increase greatly in the next coming weeks. We hope to see a flood of vaccine, in which will allow us to expand operations. We know that the mass vaccination process is not for everyone, and Sarita talked about some of our efforts in the community. We hope to expand those and bring more vaccine into specific communities, especially with Johnson & Johnson coming online in the upcoming weeks. So we'll keep you posted on that. On county outreach, the county is partnering with CGI to provide a call center to assist county in scheduling COVID-19 vaccination appointments and making outreach calls. This is not a public number that can call in. What we do is we outreach to the public and say, if you need assistance scheduling your appointment, please call us and we will help you in that endeavor to make sure you get an appointment. And they've been very successful in doing that. So those inbound calls where someone's received a message and said, and asked if they needed help, and they've called the center. So they've received 2,240 calls and scheduled 2,269 appointments for residents. So they're doing a great job there. The average talk time is 7.22 minutes. The average wait time is 2.17 minutes. So we hope to help people register. We know that it can be challenging at times to navigate your way through the system and get an appointment. So we are happy to provide that service to those that we reach out to and schedule. Great Plates continues to roll with 4,206 participants, over 1.7 million, almost 1.7.5 million meals have been prepared and sent out, 79 active restaurants. Again, one of the bright spots of this pandemic to see how many restaurants are participating in this, how many people are restaurant employees are employed through this program, and how many people, most importantly, are being fed on a regular basis through this program. Funding right now has been confirmed through March 8th. We do not know, and we probably typically don't know until like March 7th, if the program will continue. If not, we will continue it for the rest of this month in some form and work with the residents to wind it down. And then just on the current mask distribution, we've so far got out 27,000 masks, and that continues to be something that we point out for everyone to make sure that they continue to socially distance, wear your mask, wash your hands, even if you've been vaccinated. This is the critical time, the time that we know that we can save lives with people getting vaccinated and people socially distancing, wearing their masks and washing their hands. and not letting their guard down. That is the most important thing, the most important message that we want to get out right now is people cannot let their guard down. We're on a good path here. We want to continue on that path. We hope that the death that we saw here, the last one, would be the last one of this pandemic. So we look forward to that day when we can say that it's the last death, and it's only going to come if we all pull together and work together and make sure we sprint through the finish line here. With that, let me go ahead and open it up for questions.
Sarah Wright.
Sarah, how are you?
Good. How are you?
Good, thanks.
Thank you. Do you have any numbers on how many Johnson & Johnson shots we might expect to get here in the county upcoming?
I don't think we have that, Sarija. Do you know?
We have not been given that information yet. I heard that the statewide allocation was around 340,000 doses, but we have not received any local information at this time.
Got it. And in general, how is the county's supply looking? I know it's been constrained for a while, but are those numbers changing at all?
We have not seen that yet. I don't think we've received our allocation for next week. I know last week was very constrained, so that's why we only had clinics, first dose clinics twice this week, Friday and Saturday. Sarija, any more information on that?
We don't yet have information about next week's allocation. We're awaiting that information.
Got it. And for the folks through Sutter whose second appointments got canceled, is there any recourse for them through the county, or what are you telling people that they can do to secure that second dose?
Sarija, you've been in touch with them.
Yeah, at this point, we want to really learn how many local residents are affected and have asked Sutter to please give us some more information on that front. We haven't received supply to step into that role to mitigate the impact, but certainly we would want to work with Sutter partners on any avenues that could be accessed if there are appointments available and it's the right vaccine. You know, the recommendation is that the second dose follow the same vaccine, Pfizer to Pfizer, Moderna to Moderna, and problem solve. Are there any ways we can help mitigate so that that second dose could be administered in the appropriate window for it to be the most effective?
Thank you.
Great, thanks, Sarah. Any other questions?
Henrietta has her hand raised.
Henrietta, how are you today?
Henrietta, you're still on mute. If you can unmute yourself.
Yes, I just did. Thank you so much. I forgot. I'm sorry.
Sure.
This is a question for Sarija, who said that 1 in 4 16 and over in the county have been vaccinated. And I'm wondering, other than essential workers, health workers, and seniors, who is in that 16 and over? I'm thinking.
Yeah, exactly. So the first groups were the healthcare workers, which included individuals that might be informal healthcare workers, like a home health aide, caring for someone else, as well as the 65 plus. And then because last Monday, the other essential worker categories became eligible, there were additional adults under the age of 65 in education, childcare, emergency services, and food and agriculture who became eligible.
So that would include teenagers, right? 16 and up. And so what teenagers and young people?
The 16 and 17-year-olds who would be eligible to be vaccinated would need to have been working as a health aide or a childcare worker or in food and agriculture or education or emergency services. So far, those are the eligible categories.
Okay, and we've heard about children. Are there children under 16 being vaccinated?
No, neither of the vaccines have had enough data to have a recommendation for inclusion of those under the age of 16.
Thank you.
Great. Any other questions?
We have some questions in the chat. San Mateo Medical Center now faces a $52 million deficit due to the pandemic. How concerned are officials for this deficit, and how can the county help to address it?
I think, we're always concerned about a deficit. I think that the health department has done a wonderful job in laying out a plan that will bring forth to the to the Board of Supervisors in the future on how to deal with that deficit. This was a deficit that started years ago, and it's been a work in progress. I think that they've done a great job to date in trying to close that gap, and through a variety of means, through reductions of programs and through the use of one-time reserves. And I think that we're much closer to closing that gap now.
Just to correct that number, the projected gap for this current fiscal year is just over 13 million, 13.4 million, and a range of strategies, as Mike outlined, to increase revenue or reduce expenses to come in on balance by this June 30th for the current fiscal year.
Anything else?
Yes, East Palo Alto has the lowest percentage of vaccinated residents so far. Why do you think that is, and are there plans to increase vaccinations in communities like East Palo Alto or North Fair Oaks?
I'll turn this over to Sarita in a minute, but I think that there has been efforts certainly in that community and certainly other communities, but they're at 12%, and I think that it may have to do with the demographics as far as 65 and older. I think that that's a much smaller population there, and that we've made great strides to vaccinate that population so far. And I think that all of us are striving to make sure that we equitably distribute the vaccine throughout the county, but we're working through a tier system that is somewhat restrictive in who we can vaccinate. So, Sarita, do you have more on that or more insight on that?
Yeah, I mean, I think it's Astrid. I appreciate the question, and it is absolutely of priority to the county that the vaccine reach be as equitable as possible. The criteria for eligibility for the vaccine has not been by geographic community or by the case rates, those who have been most exposed. The federal and state governments really considered who are the populations for whom fatality risk is the greatest in prioritizing those who live in congregate settings and those age 65 plus, as well as healthcare workers first. But we do definitely hold ourselves accountable and are partnering with really a great number of entities with deep roots in the communities that have been most impacted by the virus, so that as residents become eligible, there will be confidence and trust in the vaccine. East Palo Alto, I believe the proportion age 65 plus is at 12%, whereas for the county as a whole, it's 17%. So our reach for the county as a whole of 65 plus is around 66%, but the younger population in East Palo Alto did not have as many people eligible in the very earliest phase. That being said, the essential workers that became eligible on Monday, many essential workers live in the East Palo Alto community and the Redwood City community, some of those in which there has been lower reach. And we are working with entities with deep roots so that there is confidence and trust. So as the groups become eligible, there will be interest in taking advantage of the pathways that are available.
Anything else?
How many workers in education, food, ag, and emergency services have been vaccinated so far?
I'm not sure we have that breakdown.
Yeah, unfortunately, there isn't a delineation by occupational sector in the data we're able to get from the immunization registry. We know that we, the county, vaccinated thousands just in the first appointments that were available last week, but we don't have a breakdown by occupational sector. That would have to be data the state collects in that category.
And now that Johnson & Johnson vaccine has received emergency use approval, what should residents understand about the product and its difference in efficacy compared to Pfizer and Moderna doses?
We just talked about this, and really, I guess the message is that, the best shot is the one that goes into your arm, is that all of these are effective in preventing death and serious illness, and that they've all been FDA approved. They're all very good vaccines to get, and we encourage everyone to take whatever vaccine is available as soon as it's available. Sarita, do you have more on that?
No, I think Dr. Fauci and our local health officials have been really trying to reinforce that important message. We have 3 very strong, effective, and safe vaccines, And we hope that we can get these to folks as absolutely quickly and equitably as possible.
Is the county currently holding back second doses?
Sreeja?
No, we have second dose clinics going on right now as we speak, as well as tomorrow. Is that the question?
Are they holding back? I don't think we're holding back second doses. We're getting them out as soon as possible.
And I would say that we have worked to assure that we have second dose for every first dose that we administer, so that we don't need to be in a position of, uncertainty about that. We look forward to continuing to work with the state and Blue Shield so that we can always keep that commitment to our residents.
Was Sutter Health one of the health partners the county recently borrowed doses from to move forward with clinics last week?
No, Sutter was not involved in in the adaptations we had to make to switch to Pfizer vaccine when the Moderna shipment was delayed due to the weather conditions in other parts of the country.
Once supply is sufficient, are there plans to open a South County mass vaccination center?
I think that the plans are certainly fluid, and we'd certainly look at that, but we really want to get more into the neighborhoods, I believe, and make it easier for people to access vaccinations on a walk-up basis, or even more micro than that. So we're looking at all options right now in regard to how we should distribute the vaccine equitably throughout the entire county.
And last question we have, do you have any statistics on no-shows to vaccine appointments, on people declining the vaccine, or on wasted doses?
So the no-show rates have fluctuated a bit, and I don't think we have a collective compilation in the 5%-ish range. When there has been more supply and more appointments available, actually the no-show rate is a little higher. So we would so appreciate the public canceling appointments if you have signed up for one, so that there isn't a no-show to be managed for any vaccinating entity across the community. Our dose wastage has been very, very low. I don't have that off the top of my head, but we did receive some feedback from one of our state partners that we were among the very lowest in terms of managing the vaccine with careful protection, so that every single dose gets used. And in terms of declination, I do not believe we have collective data on declination. I know for our healthcare workers, we're pleased to see a high proportion able to be vaccinated and complete their second doses, around 80% for our own workforce.
And we have one more question here in the chat that has come up. Has there been any discussion as to what constitutes herd immunity in the county? I heard a doctor today that would be accomplished as more people get their first dose.
Sreeja?
Well, we definitely appreciate the ongoing guidance of Dr. Morrow and our public health leaders about, we're shooting for everyone in San Mateo County who's eligible to be vaccinated, getting to 100% of the 16 plus. The different health officials have different thresholds as to what would constitute enough protection that other restrictions might be lessened. That is not now, as Mike said. We're in a period where we really urge the public to keep adhering to these precautions we need to follow.
And that is all the questions we have.
Great, thank you all. Really appreciate your time. Thank you for what you're doing out there and spreading the messages that are so important to the community. We hope to see you back in 2 weeks. Until then, stay safe.